I will be presenting an article on the impact of physical exercise on depression and anxiety in adolescent inpatients. Once I had selected the article, I devised a search strategy. This included breaking down the keywords of the title of the article and then adding synonyms to create the search strategy. The search strategy was used to find the article on PubMed. Using advanced search, I was able to search with the devised search strategy, looking for matches in the title and abstract of articles and search articles published within the last 5 years. The search strategy proved to be very useful as it resulted in the article being the first result of only 68. There is a high prevalence of depression and anxiety among adolescents, with depression being the leading cause of disability worldwide for adolescents and a major contributor to the overall global burden of disease. Depression and anxiety are linked to higher risk of a sedentary lifestyle and developing cardiovascular disease. So finding ways to mitigate this early is the best prevention for struggles later in life. We know that physical activity aids in adults with depression and anxiety, so this article aims to close the research gap. This is very important because adolescents hospitalized with depression and anxiety are an at-risk population. Of the 40 participants in the trial, 26 reported a history of self-harm and 14 a suicide attempt. Further, 35 reported a history of substance abuse and 22 dropped out of school within the last 3 months. This is relevant to the field because it expands the evidence base and helps support integrative non-pharmacological care models. The hypothesis of the article was that a brief, structured exercise program would result in a greater psychological improvement than a control program entailing social relaxation. The trial featured 40 participants who completed the 6 weeks aged between 12 and 19, having no neurological history or conduct disorders, and were being hospitalized for at least 6 weeks. Both groups engaged in activity for 3 to 4 times a week for an hour, totaling 20 hours. The physical activity, the physical exercise intervention group participated in exercises between 40 and 59% of their heart rate reserve, consisting mainly of aerobic group-based activities, where the wishes of the patients were taken into consideration to help with retention. The control group engaged in activities for an hour as well, but with reduced physical intensity of less than 20% of their heart rate reserve, mostly seated. The primary outcome was the Hospital Anxiety and Depression Scale, which consists of 14 items divided into two subcategories, anxiety and depression. The results. When looking at the outcomes, I decided firstly to focus on the median, which doesn't allow for a very favorable or unfavorable result to skew the results. The depression primary outcomes showed no change in the median score for the control group. However, there was a change for the intervention group as, as the score decreased by 3 from 10 to 7. The low end of the range also shifted downward, with the lowest score moving from 3 to 1. Additionally, there were significantly more scores of no symptoms, 0 to 7, in the physical exercise group, having 11 compared to that of the control only having 7. In the anxiety primary outcome for the control group, there were no overall improvement as the median remained at 13. However, the lower score did decrease. The anxiety primary outcome in the intervention group decreased from a median of 14 to 13. Small, but positive nonetheless. Very importantly, though, those with a score of 0 to 7 indicating no symptoms was greater in the intervention group, having 8 participants compared to the control of only 3. The biggest practical application is for the building of clinical relationships with patients. This is particularly important because we know adolescents can struggle to form therapeutic alliances, but also it has already been shown that early therapeutic bonds play an essential role in promoting early gains in depressive symptomology. Also, the intervention was able to improve self-esteem and feelings of self-efficacy, thus bringing a positive emotional response while reducing social withdrawal. And finally, with the negative side effects associated with many mental health related drugs, having non-pharmacological treatments can be very useful, especially when treating adolescents where lifestyle changes may be the most effective way to see long-term improvements. The main limitation with the study is that only 40 participants completed it, therefore limiting the ability for statistically significant findings and the ability to generalize findings across a wide range of participants. Also, there was very little impact on the anxiety symptoms for both the control and intervention groups, and the short-term intervention length may not be long enough to assess the long-term effect of exercise. Additionally, since there were no follow-ups, It's unclear whether the results from the intervention group created lifestyle changes that will allow the patients to have continued progress. Overall, the randomized control trial investigating the effect of physical exercise on adolescent hospital patients with depression and anxiety showed a strong correlation with reducing depressive symptoms for both the control and intervention groups. However, there were only weak improvements made in reducing anxiety symptoms in the intervention group. Thank you.